So this study leveraged a pre-existing database that had been set up by the network of pediatric MS centers. And so this is a prospectively enrolling database of patients who are less than 18 when they're diagnosed with pediatric MS and related disorders. And those related disorders include MOG-associated disease or MOGAD, neuromyelitis optica spectrum disorder, um, acute disseminated encephalomyelitis or ADEM, clinically isolated syndrome, and sometimes demyelinating disease not otherwise specified. So at the beginning of the pandemic, we leveraged this pre-existing system and asked additional questions during standard of care visits to better understand the risk of COVID infection among this population. And so this was a study that was done during standard of care visits in which additional questionnaires were filled out and data was collected so that at the end of this time period, we could take a look and try and understand what was the risk of COVID among this population of MS and related disorders in kids. One of the things that I think this study is notable for is the relatively large size for rare disorders. We had 669 patients, and among all of those patients, there were 73 COVID infections. I think the most notable thing about our results were that among that subset of patients who had COVID-19 and were hospitalized, 8 of the 9 of them were on a B-cell depleting therapy to treat their multiple sclerosis. Furthermore, of the 9 who were hospitalized, 5 required ICU level care, and all 5 of those patients were on B-cell depleting therapy as well. When we did further analysis, logistic regression, to try and identify or quantify rather the odds of being hospitalized among patients on B-cell depleting therapy with COVID, the odds ratio was 15 times higher for those on B-cell therapy to be hospitalized with a COVID-19 infection. This time period in which we collected data was in the early part of the COVID pandemic when variants Alpha and Delta were circulating, and largely during a time before vaccinations were available. So this study suggests that among patients on B-cell depleting therapy, specifically with diagnoses of pediatric onset MS and related diseases, there is an increased risk of severe disease. There are a couple caveats, though, to note. One is that during the time period that we were collecting this data, the Alpha and Delta variants of COVID were circulating. Largely, this data was pre-Omicron, which we know to have a less severe phenotype. Moreover, this data represents a time period in which vaccinations had not been widely rolled out, and there was limited testing availability. So I think this study should raise everybody's awareness that there may be an increased risk of severe disease among this population of patients infected with COVID-19. There are a couple important disclaimers to keep in mind, namely that the variant circulating now is different and less severe, and that vaccinations were not reflected in our study.